Today on Keynote.
Innovation is really our lifeblood for growth and for digital transformation. And ultimately, isn't that kind of why we're here?
I'm Sarah Richardson, a former CIO and president of This Week Health's 229 Community Development, where we are dedicated to transforming healthcare one connection at a time. Our Keynote show is designed to share conference-level value with you every week. Now, let's jump into the episode. Welcome to This Week Health Keynote, where we engage with top healthcare leaders to explore the intersection of healthcare and technology. Today, we have the honor of speaking with Ryan Smith, the Chief Digital and Information Officer at Intermountain Health. With over 30 years of experience in healthcare IT, Ryan has been instrumental in driving digital transformation and innovation across multiple organizations. His leadership has significantly influenced patient-centric care models and operational efficiencies. Today, we're going to dive into his journey, the evolving role of digital technology in healthcare, and his vision for the future. Ryan, welcome to the show.
Thanks so much, Sarah. Pleased to be here today.
You have had such a distinguished career in healthcare IT. I'd love for you to share what initially drew you to this field and what motivates you to continue driving innovation.
Yeah, great. So my major, Sarah, was computer science, and I was initially hired by 3M Health Information Systems here in Salt Lake, where I live, as a software engineering intern. I think that was my title. Back on the original Help One hospital EMR system that Intermountain happened to use. Intermountain actually hired me full-time as a software engineer during my senior year to continue developing on that Help One system. And I've got to be honest, I never anticipated healthcare IT would be my career. I always thought I would probably be working for like a big tech company like Microsoft or IBM or something like that. But as you know, healthcare has a way of absolutely like just sucking you into the mission of what our industry does. And I've been hooked ever since. Around the motivation for driving innovation, look, our industry is in a really challenging place. No surprise to any of us, that follow your podcasts. We have like just unreal cost pressures that we need to manage, and physicians and nurses are leaving the industry faster than medical and nursing schools are really able to replace them, especially with an aging population as we go forward. It's really going to be a challenge. And those that are still working, as we know, they're really burdened with administrative tasks that are like burning them out. And I love what our CEO, Rob Allen, here at Intermountain Health says. Says our competition isn't really other health systems in our service area or even new disruptive entrants. It's really the rapid progression of disease that we're competing with. And so, like, as an industry, we've got to figure out quickly, how do we get upstream of reactively dealing with disease and illness, and how can we be more proactive stewards of the health and wellness of those that we serve in the communities where we operate. And I look at it, and all of these challenges require continuous innovation. And we're at such an interesting crossroads right now in our industry, where this like nexus of cloud computing, large data sets, generative AI, machine learning, progress around data interoperability, they're all really poised to let us make these leapfrog advances toward rapid digital transformation in the industry. And I've got to tell you, that really motivates me. I think with all the challenges that we just have so much to be excited about as well. I'm super excited for, the future.
Yeah, it's tough times, but some of those tough times drive some of the most creative opportunities for us in our roles. And you've recently returned as the Chief Digital and Information Officer at Intermountain Health. What are your primary objectives as you step back into the role?
Well, first and foremost, I'm only like 90 days back in the role. And even though I've served, I'm like one of those 3-time boomerang employees, which, is pretty unusual, quite frankly. But really working hard to align to Intermountain's key objectives. And there's 2 primary things we're like laser focused on. One is this idea of simplification. It's really simplifying the experience for consumers and caregivers. And that second one is moving upstream, like I just talked about, with proactive care services to really focus on the health and wellness and preventing disease and to keep disease states from progressing, et cetera, and under newer kind of value-based care models. But Intermountain is really all in with this idea around proactive care, and it's changing a lot of what we're doing along those lines. For 2025, a couple of the major initiatives that we're doing that I'm kind of stepping in midstream is migrating 8 disparate EMRs to a single instance of Epic across the enterprise. We've got to go live in September. Really excited about that, and we're just up to our eyeballs making that happen. It's basically a big bang go live, and so teams are really busy, really focused on what we're doing, and at the same time, I'm coming in and also starting to put together a 3-year strategic plan for our digital technology services team, or DTS that we're called. And part of that was advancing Intermountain's digital transformation. So those are our strategies around our data, cloud, APIs, interoperability, AI, cyber, analytics, automation, you name it. That's all part of where we've got a lot of focus. And finally, I'd just say also advancing our culture of innovation. As you probably hear from everybody, it's not enough for us just to be working on cost-cutting measures. Yes, that's important. We need to be sustainable organizations as we work into the future, but that's, in essence, if that's our whole focus, that's a death spiral. We can't afford to be that. And at Intermountain Health, we're fortunate that we can both work on our long-term sustainability at the same time that we're really advancing innovation, because that's a big way that we've got to deal with those challenges that I mentioned at the first. So this culture of innovation, that's really core to what I'm trying to bring forward with my team.
And everything you talked about, that whole list that you just went through, it's what everybody is literally talking about. You're doing it with a big bang approach and by still having this whole innovation centric mentality, as well as your patient-centric mentality. And that's one of the things that Intermountain has always been known for and recognized for. How do you plan to further those types of initiatives through some of the digital transformations? You mentioned the upstream aspect, but all of these things happening at the same time, the patient is still at the center of your universe. And how do you maintain that ethos as well?
Yeah, great question. So as we look at things like, say, our digital front door set of strategies, well, they're really there to provide our patients with seamless access to Intermountain services through digital channels. One thing I learned when I was CIO at Banner Health was that patients and members of the community, they give healthcare organizations a lot of latitude from a physical facilities perspective. They understand that some facilities are 100 plus years old and other ones are maybe a year old. And so they know that as health organizations, we're going to have a lot of disparity in the physical facilities themselves. But when it comes to their digital experience expectations, they expect the organization to really operate under a very single, homogeneous, very consistent digital service expectation. And so we have worked really hard to try to enable that here. I'd say these strategies, they're really being advanced on virtually every front with how we're engaging with our patients. And internally, we refer to these like digital touch points with our patients as moments that matter. That's what we call them. And they're kind of divided into 7 major touch points along a patient's journey or path with us as it relates, to needing to have an episode of care with us. And so that's things like helping them understand and help with their learning needs, what options are there in front of them, et cetera. It's scheduling and preparing for their visit. It's arrival to their visit. It's the visit itself. It's the follow-up to that visit. And then you have billing and financial needs. And then kind of between visits, how do we help them with their ongoing health needs until that next visit occurs? And then it's sort of a rinse and repeat, and they're back on that path. And so we have this kind of cool internal graphic, of this journey through a patient's life, that along that journey, you go into those 7 steps and then you're back on that journey again. Then you go through those 7 steps, you're back, then you go on that journey again. And so we put a lot of effort and time and energy into thinking about these moments that matter for our patients and making sure that we have a really consistent process for meeting them where they need us to be from a digital interaction perspective. And we've got a long ways to go with that. I don't want to make it sound like we have arrived. This is a current kind of 3-year strategy for us to really up our game there and to continue to improve despite already having, I think, a really pretty good experience. But through merger and acquisition, it's brought a lot of new technologies and maybe some disparate by region experiences. So we're continuing to work to really homogenize that for our patients. And the impact, I'd say it's been pretty significant and just continues to improve with improved patient engagement, improved access to care, enhanced patient satisfaction, et cetera. So those are some of the things that we're doing to really continue to focus a lot on the patient.
Well, you are known personally for your ability to support geographic expansion, and you've brought that through organizations with digital leadership skills. I do want to touch on the automation aspect that you mentioned earlier, because digital now more than ever also encompasses conversations around digital employees, digital experiences, digital automation replacement, it's kind of capabilities in those areas. And so when you think about automation in healthcare and how it can streamline operations and also improve patient outcomes, what are some of the initiatives you're considering or looking at with the highest level of either success or favorability in achieving all the objectives you have on your plate right now?
Great question. And again, like I was saying at the first, with this nexus of capabilities coming together, I couldn't be more excited. I think when we all started, when OpenAI, ChatGPT, et cetera, was new to most of us, about 2 years ago, Intermountain was already well down the path at that point of a lot of robotic process automation. And when I was here previously during the first part of the pandemic, we really got laser focused on automation initiatives. And at that point, RPA was what we were all talking about. And I think things have only advanced from there. But at this point, we have over 4,000 RPA-based bots that are helping to automate literally hundreds of processes, or at least significant portions of processes that we have. Now, with some of the new tools, we're starting to see agentic AI, and I know that's kind of a 2025 buzzword, but we're going to start seeing all of the major vendors bring in their AI and automation type capabilities within their systems. And the nervousness that I personally have is that, just kind of like analytic packages that were bolt-ons, 10 plus years ago, that we all had to start paying our vendors that much more to get those, which then proliferated all of these different analytic packages. We're kind of already seeing the same thing happening with AI agents. And yes, we want to use those capabilities that are coming from our major vendors. But as I'm looking at it, something that's like really strategic for us is, again, back to this notion of agentic AI, which is the ability to not have to have a human interaction with a bot per se, but empowering that bot and making them autonomous so that they can get in and, under set of guardrails, rules, et cetera, they can make decisions and they can move work forward automatically. And one agent can be the output to another agent's input, et cetera. The challenge we're going to have is that it's not like we're building all of that. So we've got to have a lot of dependency on these vendors, but I need to be able to stitch those horizontally, so to speak, across multiple vendors, AI agents. And so we're conceiving this notion of an agent of agents, so to speak, where we can have that orchestration layer across us. And that's just going to be really, I think, important as we move forward. So anyway, that's some of what we're doing around the automation side, but we're going to see automation, I think, virtually touch every aspect of the business within Intermountain Health. And I'd be very surprised if that isn't ultimately the answer for all of us as healthcare organizations and as payer organizations, because we need to get that level of support, enablement, automation happening within our organizations to take cost out, to help remove a lot of the mundane tasks that our caregivers today have to do, and it's burning them out and they need relief. And as we talked about earlier, we just don't have enough, nurses and physicians. And for the trends of where we're going again, we've got to figure this out. This is really key. And that's why I think it's just a super exciting time for us to be here in the industry.
You mentioned that agents talking to agents, these bots, and the reasoning capability that bots and agents are starting to be able to have. They can make decisions, they can come out with outcomes. Heck, they can even automate themselves and predict some of the things that are occurring. But to your point, all of that has a level of both interoperability concerns, but more importantly, some of the cyber aspects that come with that, because it's these massive amounts of data that we're having to parse out and still protect while we're sharing it through APIs and other functionalities. What's your approach or some of your thoughts on how you protect the organization from a cyber perspective?
Well, yeah, I mean, we see in the news every day, right? This is one of our key challenges as an industry. Healthcare has been woefully slow to adopt, to embrace, to invest in a lot of the, cyber protections and measures that we absolutely need. And it's just wreaked absolute havoc on our industry. And so we kind of look at it, Sarah, as protecting patient data is really important, obviously, but we're trying to take a little more expansive view, and we look at it more as protecting against patient harm is really our top goal. So how can we make sure we're looking at how we can prevent the taking down of critical life systems, et cetera? And as part of doing that, we're also protecting patient data. But, our top goal is to ensure the reliability, the stability, the availability of a lot of these health life-saving kind of IT systems. So part of how we're doing that, if I boil that down just a little bit, is one, we're fortunate to just have an awesome cybersecurity team here. The company from very early on has really invested in our cyber capabilities, and that affords a portion of that team to really think like bad actors. And that's what we kind of have to do these days. So we look at some of our top cyber threats, how the bad guys are getting into other organizations, and it's really kind of threefold. It's the age-old social engineering. We've seen a lot of third-party compromise and also just system vulnerability compromise that is the problem. And as we're looking at that and trying to peel back the layers of the onion, as they say, we kind of think about things in terms of with our IT systems as sort of three tiers. You've got tier 0 at the top. That's your domain, your enterprise admins, so your directory databases, your domain controllers, et cetera. You've got tier 1, that's all of your servers and your server admins, so your EHR, your ERP, your business clinical apps, your EDW, all of those systems. And then we look at and think about tier 2 as our workstations, our device admins, et cetera. Well, what typically happens is the bad actors, they come in at tier 2. They compromise either through the social engineering compromise or third-party compromise, something at that level, at a workstation individual user level. And what do? They work their way up. And if they can get up to that tier 0, it's game over. At that point, you're shut out of your own environment and you virtually have no other realistic, pragmatic opportunity other than to literally rebuild your infrastructure, right? Because otherwise you have to assume the bad guys are still in there. And so we're putting a lot of emphasis in how do we ensure that you can't have that traversal up those tiers or being able to cascade or have an exposure going down. And so a lot of separation and abstraction between this tier 2, tier 1, tier 0, in essence, just to prevent privilege escalation, and a lot of effort going into that effort. Is it foolproof? No. But this is an area that the team just works tirelessly on day in and day out to really try to, keep us safe.
And just the aspect of educating organizations about how to stay safe from a cyber perspective is a ton of energy, because that social engineering piece is all of the time. Even when they know it applies to their personal lives, there's still mistakes that they can make in the workplace. And then having a culture that allows you to say, oh, I'm sorry, I might have clicked that link. That's one aspect of what you're working on in your organization to keep it safe.
Absolutely.
Plus some of these big bang approaches for operational efficiencies. What are some of the tricks that have worked for you and approaches for the organizational change management aspect of what's going on? Because at every single city tour, dinner, or summit we hear mostly two things now, besides reimbursement and other concerns. It's the OCM aspect of getting things done, and it's the governance to make sure we're doing the right things. How are those things appearing, I guess, for lack of a better term, inside of Intermountain? How has it changed since you've come back, and where do you see some opportunity there for your organization too?
Well, it's such a great question, Sarah. One area that I've seen that just speak volumes to is with our Epic migration, okay? This will be one of Epic's largest single instance cutovers, go lives that they've had. And as such, every time, and we're kind of at the front end of getting into some of these operational change management things where it's now not just my DTS team, with medical informatics and some others. It's like, okay, we've got to get 55,000 caregivers registered for training so that they know how to use the system. And every one of these big spikes, whether it's getting people registered for training or going through the training or doing our operational kind of technical dress rehearsals or whatever the case, I've been so impressed here returning back to Intermountain Health to see the level of senior leader engagement through governance to really help protect the time that we need our DTS caregivers and other operational leaders to really focus on these critical path kinds of activities. And we just have such a great level of transparency and expectation within the organization that, if you have a problem start to surface, instead of teams trying to not talk about that or trying to stifle it or not let it be known, that immediately is escalated up to the appropriate level so that we can help. So that as leaders, we can really lean in and say, let us be helpful. Let us help you, with if it's prioritization issues, whatever it is. And I've just seen this great kind of top-down support for a program like this. We're working on really trying to get that level of governance in across, everything that our DTS team is involved in. We want a lot of co-sponsorship, co-leadership, business-driven governance. I'm a huge believer in that. I have found things go so much better when we work together with our operational stakeholders, when they feel a lot of ownership in what we're doing. In fact, we were at a regional meeting yesterday with all leaders in the organization of this particular region, and our chief physician executive, he came in and there was a question about the we call it Epic Journey. And he was really quick to say, hey, first thing I want to say is this is not a DTS project. This is our project, talking about all of us in here, and it's going to take all of us to be successful here. And I love that kind of just operational stakeholder executive engagement, because that's what helps these kinds of projects be as successful as possible. So I think it's a great question. We're focused a lot on operational change management because at the end of the day, it's a big part about how we think about innovation within the organization. We have a ventures team that you mentioned, and they're always scanning startups and looking at opportunities. And as such, we have an opportunity to run quite a few pilots within the organization. And I love how our managing director within the ventures team kind of talks about how, we scan, we start a pilot up, but pilots realistically, if done well, they should probably be like 60 to 90 days and either move to that next tier or they go away. But how many of us have like these 2-year-long pilots and you can't get them out of a single hospital, but they're too big to shut down? And it kind of reminds me of 2008 when looking at the banking industry, well, they're too big to fail kind of a thing. So we're just going to keep figuring out how to support them, but we can't scale them. And that's not how we look at innovation here. We're really increasingly looking at innovation of learn early, fail fast. If that's the outcome, that's okay. And for things that are working, how can we get that to scale and to get it to full implementation production across the entirety of the organization? And that takes a ton of operational change management, but that's just so hand in glove with how we're thinking about innovation that it's a really important subject.
And to your point, pilots that go on into perpetuity that never really end or go away. And then even if it's not a solution that the organization loves, somebody loves it and it just sort of sticks around.
Right.
And to have that type of discipline and governance and structure around the ability to say, this is a pilot and we have 90 days to figure it out. And that's how your innovation wheel is going to continue to spin, because people are willing to try it and move on and look for the right next opportunity. How do you avoid pilot fatigue, though, by having an innovation center and keeping the lights on with all the different projects you have on your plate? How do you actually help prevent innovation fatigue?
It's challenging.
Or pilot
I've got to
fatigue.
admit, we have the large percentage of my team, they're a lot more focused on day-to-day project work and keeping the lights on, right? And so some of these pilots, from their perspective, they kind of come in from the side. They need a lot of attention. They need it pretty fast. It's competing with the work they've got on their plates. And so again, that kind of comes back to the governance piece of it. And so a branch of our overall DTS governance is really around kind of introducing new technology in, and we're pretty careful there so that we try to do as much as we can in the lab that doesn't impact, a lot of my regular teams like cyber and infrastructure and operations, et cetera. But if the pilot goes well enough and we need to scale that and kind of start getting that actually out of the lab and into, a broader pilot, so to speak, it can be really challenging. And I hear about that at least a few times a month where my team is kind of crying foul a little bit over like, hey, how do we do both? But I remind them we have to do both because innovation is really our lifeblood for growth and for digital transformation. And ultimately, isn't that kind of why we're here? It's not just keeping the lights on. It's not just for getting our 200 annual projects done. We have to, at the pace of business, we have to be bringing in new ways of doing things. And it's our job to help enable the rest of the organization to be more nimble, right? To be more agile, to test things and to really help the organization move forward. We've got a big part of that as our responsibility.
We do. And I'm going to ask you one final question before
Hmm.
we head into speed round, which is a little bit more of the fun questions. When you look ahead, and I'm not going to say it's 3, 5, 10 years, it just depends in so many different healthcare settings. What do you, Ryan, envision as the biggest challenge and opportunity in healthcare IT over the next few years?
Next few years, well, we're going to continue to see a lot of margin pressure in our industry, no question about it. So how do we advance innovation at the pace that we need to advance innovation while we're being good financial stewards, which oftentimes means how can we sign up for a 2 to 3% year over year, say, cost reduction while we're keeping the lights on, while we're advancing projects, and we're doing these really innovative things. That's the world we live in. That's what I think our stewardship is as we move forward. So that's certainly one. We're in somewhat challenging, I'd say, policy environment as well. Most of us wake up each morning and turn on the TV or listen to the news as you're driving in, only to find out that, oh yeah, hey, something changed, either at the state level or at the national level. And so trying to keep up with that and understand what impacts that has on us, that's going to continue, I think, to be a challenge for the foreseeable future. And as part of that, we're trying to lean in as much as we possibly can to help advocate for certain positions, again, at the state legislative levels, as well as at the national levels, and trying to have a voice and trying to partner with other organizations to have a broader, more collective voice. But it feels like it's changing every day, and it's just something we're just going to have to continue to really keep an eye on. And then probably the third thing is I am really concerned about our physicians, our APPs, our nurses, and other clinical caregivers because they're change weary. A lot has been thrown their way. They continue to be asked to do a lot with fewer resources. And again, like we talked about at the first, this is an area that I think it's our moment to be able to shine digitally, to do whatever we can to help these caregivers be able to show up, bring some of that joy of providing care to our patients and members of our communities. And it's such an important mission. And I think about Intermountain's mission of helping people live the healthiest lives possible. And to do that effectively, our roles as digital leaders is just so vital to helping that for the future. So those are probably the three things that I kind of personally look at as most challenging. Cyber, that's just interwoven in all of that. Okay. So I'd be remiss not to mention that not going to be a continued challenge as well, because it absolutely will be.
The desire to get physicians in a place where the joy of medicine, because they get to spend more time with their patients, we're actually at a place where we can do that better than we've ever been able to do that since introducing, honestly, I'm just going to say the burden of the EMR into their workflow. And I'm very hopeful at this point in my career to be able to see more and more time given back to a physician or a care provider to spend physical face-to-face time with their patients.
Absolutely. And I'm like super excited about all that we've got going on in that realm as well, because we are both helping to save time with a lot of those mundane administrative tasks that clinicians just hate. And a lot of that's happening after hours, it's kind of pajama time, and bringing some of that joy back into caregiving and just giving more face time, literally face to face with the patient instead of face to ear as the physician is typing in notes or the nurse is typing in notes, just to be able to have an ambient conversation that's being recorded and translated. And it's definitely moving in the right direction. And I'm, again, just excited about where the future of that's going to take us. We're just at the forefront of this, and it's just going to get much, much better.
We know that you're going to be leading the way. So we'll talk about it every probably year, just to make sure we get to hear all the amazing things you're doing with you and your team in Intermountain Health. Okay, speed round questions. These are the really hard questions for today, Ryan. What is the one piece of technology you cannot live without?
I would say probably my smartphone. Okay, I'm an iPhone user, but probably my smartphone. But if I think about it, it's probably like my Copilot and my ChatGPT apps on that smartphone. I can't imagine getting by without being able just to bounce ideas off of these LLMs and getting pretty decent answers coming back. Not perfect by any stretch of the imagination, but yeah, somewhere between large language models and GPTs and my smartphone. That's it.
I would agree, by the way. If you weren't in IT, what career path might you have chosen?
Ooh, that's a good question. I was a computer science major, like I mentioned, and if I wasn't in healthcare IT, I would have definitely still pursued a career in software engineering. Yeah, I've just always been passionate since a really like about junior high timeframe when first 8086 computers, Macintoshes, et cetera, came out. And I just found myself completely immersed in those and trying to figure out basic as a programming language and then Pascal and what have you. And I was just such a sucker for those personal computers when they very first came out and continue just to be a huge fan. And it would definitely be something technology related. I'll leave it at that.
I laugh as you say that because I grew up in the era where we had like command prompt video games. The adventure games
Oh,
would
yeah.
have prompts for a period of time. And so we would just have paper all over the walls mapping out like the environments. And here now kids have everything on their iPads right in front of them. Now it's all 3D to a degree. It's pretty incredible to see how far
Yeah.
we've come in a semi-relatively short period of time. What's a book that you have enjoyed and recommend for our listeners?
All right. Great one. So I'm currently listening to an audiobook. It's called The Digital Mindset. I'm really enjoying it. I think Paul Leonardi is the author of that one, if I'm remembering right, but The Digital Mindset. And it's just a really great way. It's not healthcare specific, incidentally, but it's a great way to just how to be thinking about digital transformation within any industry and some of the key skill sets that we need to have if we're going to be relevant. And especially, I think, as leaders that are driving digital transformation, I'm learning quite a bit from it. A lot of it's like, yeah, but there's a lot of stuff also. It's like, oh, that's really great advice. Probably another one that I read recently that I really enjoyed. It was the one by Reed Hastings, the founder, CEO of Netflix, and it's called No Rules. I think the title's a little longer than that, something about Netflix innovation or culture or something like that. But I've really have enjoyed that one as well. And that one talks a lot about how to really effectively empower your whole organization and not have everything be a top-down bureaucracy, but to really delegate decision making and how that really fosters such an awesome culture and a culture of like reinvention. So I've enjoyed both of those books.
We'll put them in our show notes for sure. And thank you for sharing those with us. But Ryan, thank you for sharing your insights and experiences with us today. Your leadership continues to shape the future of healthcare IT, and we look forward to seeing how Intermountain Health evolves under your leadership. Thank you for listening to Keynote. That's all for now. Thanks for listening to this week's Keynote. If you found value, share it with a peer. It's a great chance to discuss and in some cases, start a mentoring relationship. One way you can support the show is to subscribe and leave us a rating. If you could do that, we'd appreciate it. Thanks for listening. That's all for now.